a robot is, how does it make surgery so efficient, and how he goes forward to it. And I welcome Dr. Chandramohan, who has been our big supporter of QPMBA, to introduce our speaker, Somasekhar sir.
So, good afternoon, everybody. I'm a surgical oncologist. I have the privilege of introducing Dr. Somasekhar, which I wanted not to give to anybody else. Because we all studied. He's a cancer surgeon like me. We studied in an institute called Gujarat Cancer Institute in Ahmedabad. And he's 6-7 years senior to me. And one thing I like to tell about him, he was a bright student. Then he passed out. He joined Aster, Manipal, as a surgical oncologist. And somehow, I think within few years, he has done so much work in this, not only in cancer surgery, developing new technologies and doing research. And because of that, I think he has the entire surgical oncology fraternity of India. There is an association called IASO. I am the secretary of the IASO, Indian Association of Surgical Oncology. And we are so proud to have leaders like Somasekhar. I think two important things he does in surgical specialty is robotics as well as a technical high-tech for advanced cancers. And he's an international trainer, a researcher, a stalwart in the fraternity of surgical oncology. I am so happy that he's in Trivandrum. He came to RCC today and took classes for us. And he will be talking, and again in the evening we will be taking for our oncology sessions. And not only that, he's an example of how a surgeon can be transformed into a CEO of a hospital chain. He's a medical advisory board director of Global, Aster Global. And I'm so proud and presenting Dr. Somasekhar. Please, and he'll be talking about robotic surgery. I think the Trivandrum is lagging behind robotic surgery, and very soon RCC will be acquiring the robot to do cancer surgeries. I hope he's giving a lot of insight about the new technology, which is robotic surgery. Over to you, Dr. Somasekhar.
Thank you very much, Chandramohan, and thanks and pleasure and honor to be here among all the great minds. So I will try to cover, how robotic technology actually changed. We always say that as a surgeon, all the technology happens in non-surgical field. Medical oncologists get to have the latest of the immunotherapies, targeted therapies, which are $1 million. Radiation will get one of the state-of-art, radiation machine, proton, then cyberknife, and robotic arms. Surgeon, nobody is bothered or cared, because we always say fondly and loosely, surgeon is a daily wage manual laborer. You may be president, you may be prime minister, you may live in White House, you may live on the moon. Still you have to wear the gown, wear all the dress, stand morning tuning, and you are a manual laborer, daily wage person. Morning tuning, you have to use your skill. There is no shortcut to that. Otherwise, you see all the radiologists sit in beautiful AC room and multiple gadgets as if they're looking at Mars, spaceship, and then beautifully they perform. And you see any industry, health industry, the technology everywhere, but surgeon is the only guy who stands full day manually perform that surgery. So no advantage happened, so much so that even a single chair was not offered to surgeon. You have to stand and operate all 11 hours, right? You just have two hands and you have to fight with your assistant, anesthetists, nurses, Tom and Jerry. So you keep fighting and you have to still produce the best result in the available circumstances against all physical odds with no water, no food, and especially cancer surgeries go for 10, 11 hours. So no technological innovation ever happened to make a surgeon comfortable. Is it true? First time something happened, actually for some reason, that is not that surgeon, patient-centric, things happen to patient, and it so happened that, surgeon has to be there. You get that nice cushion chair, relax, don't sit, and that is what the driving has happened. I'll take you through my journey over last 15 years of doing over 3,800 complex robotic surgery, the largest in India, how I went through this journey and how we transformed and changed the healthcare and what is that for healthcare and also individuals, patients, newcomers, and also veterans to take it. I bring warm regards from Aster International Institute of Onco group of Aster hospitals. We always say that truth and technology doesn't wait for anybody. Only a fool would say, no, I'm not interested, I'm very good. You'll be wiped out, washed off. You'll be sitting in this platform, train has moved into next station to next country, like a bullet train. So somebody who doesn't embrace a technology is the biggest fool in the health industry. In the whole world, wherever you are, we fail to understand technology is here not to replace us, to augment what you do and give the best to the end user who is a patient centric. And that's very important. Why, everybody resist? In general, doctors are really, because you come very hard way, so it's very difficult to give it up. It takes so much to be a doctor, work hard, and then you do MBBS, then 5.5 years. You are a cream of your class, then you do post-graduation, MSMD. You thought you achieved everything, then you realize you're no more than a traffic police, then you have to do a super specialty, then you come out and they say fellowship, then you say, oh, robotic program, high-tech program, what is happening? You and your child work together, study together, child is settled before you, and they say, what's happening with these doctors? So very difficult, they're very touchy persons, they don't give it easily, because only they know the path what they have taken to reach there. So very difficult to change the mind of a doctor, right? Now among that doctor group, there is one more group, surgeon. Very difficult. Ego bigger than the incision, bigger than the surgeons. Even more tough to, convince them. So, cancer surgeon thought, no way, my skill is known by the longest incision I take. Biggest suture I give, used to take a pride. Count 1, 2, 3, 4, 5, 6, 7. 72 sutures. What a great surgeon this person is. 15 tube you put to the patient. Wow. 10 days ICU, 20 days in hospital. Great surgeon. So, we all got into that era. I got trained from a surgeon who was from UK, and when I did my first, I thought, wow, this is what is surgery. But I told you, two people, only a fool would not embrace the truth and the technology. Technology keep going because, there are lateral thinkers, they are good people, they keep innovating, and this younger mind has no fatigue, right? And technology, only sky is the limit. The paradigm shift in the surgery started, whether you like or not, everything from open moved to minimal access lab, and then suddenly robotic came. I always use this to all my fellows, I trained over 130 surgeons, robotic surgeons, and a lot of other fellows. In every field of the world, there is something called as excellence path, and then a wooden of leadership. You can choose to be at the base of the pyramid or a tip of the pyramid. Nobody, your father or anybody is going to take you in, up by a lift. You have to walk through that path. Maximum we can go to the base of the pyramid. That is where after MBBS we are. We think that, oh, I got a medical seat because I'm the best in my class. So what? You are at the base. Then you have to be still best to do master graduation. Then you have to be best to do MCH and DNB. Then after that you understand you are led to open sky, and then a million people like you are there, probably better than you. So then what is that it takes you to reach that excellency tip of the pinnacle of the pyramid is something which is different. They always say, all the nice men who have worked hard, who are at last part of the pyramid, sleep in the night, and only those people who want to reach at the tip burn the oil in the midnight, their personal life, family life, food, water, and they reach there. So there are two types of people in this world, revolutionist and evolutionist. One who believes Darwin theory, very happy, monkey slowly will become human being. Why should I worry? I just go through the path. One day I'll also become, human being from monkey. That is a evolutionist. And I've never seen a monkey becoming human in my life, but I've seen human being become monkeys. That's different. So another group of people who are revolutionist. Either you can see a moon, and then you can think that, wow, I'm going to take my girlfriend, my wife, my family, and I will nicely take for a candlelit dinner below moon, happy, come back home. Or you look at that moon and say, I'm going to put my foot on that moon one day and I'll conquer it. They are the lateral thinkers who left a mark in the history. Revolutionists come quite less in the history, but they change the mankind forever. So you have to choose, you want to be a evolutionist or a revolutionist. That is where the technological zeal. We always say, I told you, surgeon is a manual labor, daily wage. Doesn't matter. An engineer may build a spaceship, but he cannot go in that. Ultimately, astronaut goes. You may pick the best robot. Who operates? Surgeon operates. You may make a beautiful AI. Who is going to use it ultimately? So it's nice. So it's very, very nice to understand. Use the technology where the great minds build for the best to understand the patient. That's how the innovation of the robotic happened. And when it happened, as Arthur Clarke say, a technology at a primitive area when others cannot think looks to be magic. But later it is proved to be a part of science and evolution. That is one of the reasons the Leonardo da Vinci, whom we all think that, wow, he made a beautiful Mona Lisa, and he made, not many people know, he made the first flying thing, not the Wright brothers. So he was a great scientist more than a painter, who made the first robot with an internal circuit, which was used to entitle and enjoy the kings. And that is when the name came. That's why the first robot made ever was called as Da Vinci to commemorate him. Now, why do we need a robot? There are three spaces in this world, fields, where zero error margin has to be there. You know that you walk around, you walk 50%, you still go down. You drive down 80%, you still drive down. But if you don't do 100% every step, zero margin error, there are three fields. One, if you are going to handle a atomic zero error, you can't say, sorry, I spilled a uranium down. No. Second, space. You can't say everything is beautifully built. Sorry, that one small nut I forgot, it will explode. Third is human surgery. You can't say, I took all the stitch, sorry, that last stitch of a blood vessel is loose, patient is die before you come out. Last stitch on an intestine I forgot, so it will leak and die. So that is why rightfully a robot came in this. That is where the DARPA, all the money from Defense Academy of Washington, with a like minds from NASA and Stanford. The happy news is more than 60% in the team of that Stanford and then NASA were Indians, because we all know that the Indian brains are one of the best brains. Very hard working, no opportunity. So everywhere we go in search of opportunity. 99% brain hard work, 1% opportunity, you create revolution. Many other people, 99% opportunity abroad, 1% brain, and they're equal. Sad. That's why. So this is what was created as a robot. And when I thought I visited, when I was young, I went to NASA, I looked how this technology came up before I used the robot. Not many people know, to do a robotic surgery, you don't have to be in the same OT, same hospital, or same country. You can sit today here, operate somewhere in Delhi. So the first robotic surgery was done, surgeon sitting in New York, patient sitting in Strasbourg. From there, through a line of internet, he operated. So today, any robot, anywhere in the world, you can sit anywhere in the world, and imagine how much it will empower the rural area. Difficult to get talented pool. If you move robot all around, and then there is one central hub, a surgeon sits here and operates everywhere, how healthcare can reach and you can empower the people. So these are all the benefits of the robot. What are they? It has got 4 arms. Now the new Indian robot has got 5 arms. I always say that with 2 arms, you do so much wonder as a surgeon with your 10, 20, 30 years, decades of life. Imagine suddenly now the God comes and says, I give you 5 hands. And in the robot, you see 12 times magnified. You can see nerve, vessel, everything. And it is a 3-dimensional stereoscopic view. And then you control the camera and everything. Motion scaling. If you are about 60, 70 years, you have developed some Parkinsonism, the robot cancels that. Your brain intact, you can operate. So stable, you can do. And all to that beauty is, you sit and operate. No need to even wear the surgery dress. You have a cup of coffee, sit beautifully and operate. So imagine what wonders one can do with that. You may be left hand dominant, you can operate with right hand. You are right hand dominant, you can operate with left so fluently. So this is a technology which gave. Rightfully, the moment robot was introduced, there was a 30% growth in complex surgeries. Like for example, nerve preserving, urine sexual preserving prostate surgery, which was a nightmare. Same surgery, same organ, same disease, same surgeon, same patient. All these decades of human being, nothing happened. Suddenly a technology comes, 34% of them were high. Similarly, in various fields, minimal access is the best in the world. Open surgery is the worst for any surgery, healthcare, complication, economics. But yet, in spite of the best minds, less than 20-30% were embracing. And the moment the robot came, with a tip of 3 millimeter, the hand of the robot can move 360 degree, which human being's hand cannot move. And it can go to any part of the body, deep-seated, you cannot go. Such 3 arms and a camera, which revolutionized. Like for example, to do a bypass surgery, you have to cut a bone. You have to stop the heart and lung, do the 10-second surgery, and patient goes to ICU, heart-lung machine. But the same patient, if they had, this is a case who had a robotic, 16 hours he is discharged without cutting the bone, no heart-lung machine, no ICU ventilators required. That is the beauty of the robot. Because with the robot, a small grape look 12x magnified for you. One arm of the robot is stabilizing the grape. The other 2 can peel the skin of the grape without touching the pulp, with a surgeon sitting there without anybody assistant. And imagine that technology, what it would do. This is a cancer surgery I'm doing in the pelvis, looking at something called lymph node. The one I'm holding on the left hand is a big blood vessel go to the leg. If I cut that, the leg will be lost. But look at the way the robotic arm can go down, dive between the muscle into the between the blood vessels, go down, and the third arm of the robot, we always call that our best assistant, would go down, separate everything, fix that. No matter earthquake happens, you fall down, it will not move 1 second, 1 inch. It will give the same level of exposure, retraction. There is no fatigue to this robot with an artificial intelligence which does a error check 1 million times every second, and you can go back and do the surgery. This introduction changed the whole healthcare. Suddenly, what was at 10-20% went up to 90% of minimal access, whole world, and complex surgeries. This is a surgery where you can see a liver transplant being done with the help of a robot on a big blood vessel going into the heart and taking the liver. Things unseen change the whole issue. Imagine if these patients go home in 48 hours, bloodless, with low cost and no ICU stay, what an impact on the healthcare. Patient's family, loss of pay, loss of work, all these things can be changed. The beauty of the robotic technology is huge magnification, stability, multitasking, bloodless surgery, and painless, where practically patient would actually walk. With all the work I have done, 3,800 and all my people, we found that what it takes 10 years for a surgeon to master, you can do it in matter of months. The learning curve is shortest in robot. When I audited, my whole surgery, when I did 3,600, I could see that in a matter of 15 cases, we could master. Imagine, you're still not learner, but you become a proficient person. Like, I'll give an example. This was a young patient who had a tumor in the chest. We put the robot, there is a beating heart, and this tumor is sitting next to the heart, stuck to the heart and the lungs, but the robotic arm would come. There is an artificial intelligence enabled in that. You can analyze the path you want to take, and there is a laser in that also. There are stapler, there are vessel sealer. Look at like a swan neck, how it turns back and operates, which human beingly not possible. This surgery took 45 minutes, Saturday morning admitted, operated, Sunday morning discharged, Monday he goes back to work without a cut and a micro anastomosis. Second issue is, there are some surgery we do bags for motion to come, stoma. A beautiful flower-like purse string suture which it takes. Gifted persons who can do a handicraft, and you can avoid doing a lot of bags, unwanted surgeries. And you can do very complex surgery. For non-doctors, this is a nerve which controls the urinary function, motion function, and sexual function. Believe me, I passed my whole surgical training without ever seeing this nice naked in my eye. They're so thin like air. Our boss used to say, oh, this is a nerve, and we used to say yes, because there is something called rule number 1 and 2 in residency. Rule number 1, boss is right. Rule number 2, boss is wrong. Refer to rule number 1. So boss used to say, that's a nerve, and 2 times he says yes, we say yes. First time we started seeing them actually when we started doing minimal access surgery. And this was a study and work I did comparing with robot. If you do that surgery, chance of having normal urine motion, sexual functions versus other, comparing to the study done in UK, which was my group, which we published and showed. It is an outstanding. Second, what you can't see. Remember, you're sitting, all of you are hungry, I'm standing for lunch. You just want to know, is dessert served there, is lunch being served, what is the queue, what is the plate? If you are like a Superman, see through the wall what's happening there. This is a technology called Firefly built-in robot. It will show me where is the duct which is going. I have not even kept a cut. Can you imagine if I hide a small pin in this room, even if I give you 1 million years, none of you can find it unless I tell where it is, right? But in robot, you have this technology where you can go down easily and check this Firefly technology, and you can see where that cancer cell is hidden or an important area. Second, if you have any cancers in the voice box, mouth, normally how do we do? Because everything cannot go through the mouth, we cut the jaw, we put the feeding tube, we keep the breathing space. Now this is a robotic surgery. It was the first surgery I did 2011 August. He was a very VIP minister in some major government in India, and then he didn't want a scar on his face because he goes for a campaigning. Through the mouth the robot went, and I'm sitting there, everybody's enjoying in the OT, and now this is how I would look inside the mouth. We say that, Yashoda opened Krishna's mouth and he showed a Brahmanda. This is how it looks inside. This is the whole part of the cancer, the tongue, the voice box, all the instruments move the way they want. And then I'm sitting on a chair, relaxed with a cup of coffee. We go ahead and we remove all this tumor completely. And this is how a patient goes home without a scar, same day eating normally. Similarly, imagine you have a big thyroid tumor you want to do, you don't want to put a cut in the neck, the same surgery we do through the armpit without a scar, scarless armpit surgery. And can you see that white nerve? That is the nerve which controls your singing, high-pitched voice. We touch that, forget singing. That's the end of your life. Only your husband will be happy, but you'll never be happy in your life. Your voice is gone there forever. So, but this is what the robot does, and you can remove this tumor. And this was the first patient I did in 2011, scarless, she could go home. Then we went on to do several, and we have published how to do these surgeries, which is very, very unique. Second thing, these slides I borrowed from my wife. My wife is a pediatric cancer surgeon who does robotic in 1, 2, 4, 5-year children. Children are the basis of the family. If there is any problem, the whole family gets affected. But imagine if you can do the small surgeries. This is a 3-year-old child with a lung tumor. This is a 2-year-old with a liver tumor with a robot you can do. And this is another 10-year-old baby with a pancreatic tumor. All these surgeries are done, and child goes home next day without pain, eating normally. And this is what I told you, a Firefly technology, where the green light fluorescence laser like a Superman will show you where the tumor is. So these are several advantages that is there. Now what is its impact? In about last 5 minutes I'll include. When I look back in my institution when I started, the moment a robot came, 17% of more volume I could do and reduce the cost to the healthcare by 34%. We can also do remote telementoring and operate together. I can sit here. This is a case. I sat in Bangalore, operated in Mangalore, and this you can do through this particular technology available. So 22% of minimal access became 95%. Exponentially we went up. We brought down the cost to healthcare in open surgery to minimal access significantly, and we could travel and train all the people. This is my colleague. This is one of those places where 2 robots, 1 patient, 2 people can do together. He's my close friend Saklani in Tata, Mumbai. We both sat together, and I'm sitting there, he's sitting and operating together, which we could do, and you can do a training programs. And now this is a new robot which has come. You go through the belly button, it opens through that, it opens into an endorex, and it has also got a telescope and a microscope integrated, do the surgery and come out, and you can know where a microscope in the camera is fit up. Now this is a new robot called Sophie robot, which is from Netherlands. It goes into the eye and it does all the retinal surgery in a micro environment which is already available, which is a very small bot robot which is available, which has come down. And this is now the future. Advanced simulation, augmented reality, interplay of all your AI and technology into this particular area, which is actually impacting, and you can do that. That's why I always say the future depends what we do for present. So if you look in India, way back we have 6,700 system and over 5 lakh procedures done, and you can see exponentially it has gone up. But the only limiting factor for a technology like India, this was introduced by Professor Srivatsa in India, when our great President Abdul Kalamji was was visualizing it. That is the first robotic surgery. From there, now a huge leap has happened. Yet in India, the robotic is at tip. Very few people have an access. Lot of other miniaturization required. Now insurance IRDA has approved robotic surgery for all the people. And we always think, why should we borrow a 20 crore machine from outside when we can have make in India? We use 1/10 the cost and put 104 satellite from India. And we use a cost of an auto rickshaw going from here, and we reach Mars there. And why not a robot? That is why an Indian robot has come at 1/10 the cost, at 100 the cost of a surgery, made in India, make in India, which is available. Is a Professor Srivastava who holds a world record for 10,000 cardiac robotic surgery. And he came back from US and made it, and this is available today, available in 18 cases. Also in Dubai it has been put, and it's very important. India gave a message, cheap is not inferior. Expensive is not always good. So this is where we now have our own robot, and we decide how to actually do this particular technology. I always say that, if you go to Sistine Chapel in Vatican City, Michelangelo drew a picture, life of lease by God to Adam. And this is the first time a robot gave a lease to a surgeon who is very important for patient, whether we like them or not. But it's very important to know a fool with a tool is still a fool. It is the man behind the machine and not the machine who is in front of the man. Thank you very much.
From what I understand, my career is shortly going to be taken by robots. I hope it doesn't. ಮಮ್ಮಿಗೆ ಸಾರಿ ಹೊಡ್ಕೊ ಪ್ಲೀಸ್ ಚಂದ್ರ.